I'm here this morning with obviously Dr. Kerry Chant. I just want to thank Kerry again for the extraordinary job that she and her team have done. And I'm also here with Jenny Musto, who, where is she? Jenny Musto, who will also address us. She is the leader of our COVID detective team, who have just done incredible work yet again to do what we need here in New South Wales to link in, to triangulate on the cases that allow us to manage the cases more broadly throughout New South Wales. First of all, just updating you in regard to the current cases. Just remind you that up until the last couple of days, we'd basically had almost no cases, pretty well no transmission cases in New South Wales for the last month or so. So we had got into a regular pattern of announcing to 8 p.m. each night, but announcing it the following morning so that people could just keep a clear idea of how many cases we had. We've had to change that a little bit because when new cases have come up, if they've been somewhere, we needed to make that immediately available to the public because it also allowed us to say to members of the public, if you were here at this venue, contact us, come and get tested so we can do our tracing. So it is a little bit different from normal. But so just reminding you, to 8 p.m. last night, we had 13 new cases and 3 of those were return travellers. 10 of them were related, though, to the Crossroads Hotel issue. Of those 10 cases that have direct connection to the Crossroads Hotel, 6 actually attended the venue. 2 are close contacts of people who attended the Crossroads Hotel. 2 acquired infection at the Planet Fitness gym, which is very closely associated with the Crossroads Hotel. And of course, we had previously announced 1 person there who had been identified from the gym as well. I want to thank the community. We have an amazing community in New South Wales. We are, as we've talked about, at various stages we've described this as being a bit like a war, although I think we'd all settled down into a more of a peacetime approach in the last month or so because we were doing so well here in New South Wales. But when the war front comes, when the wartime comes back to us, it has a bit in the last few days, our community steps up. They are frontline troops, front and centre. So we got 3,297 people, that's extraordinary, putting themselves forward just in the last day or so to be tested in our southwestern clinics. And that is amazing. So thank you to each and every one of those people, because without them coming forward, there is no way the team, of which Jenny Musto is such a critical part, could do the work they need to do to triangulate or link in on who are the carriers who have actually got the virus and who may infect other people. So thank you to them. Can I say we've had massive pressure in the pop-up clinics. We've got a range of hospitals in the southwestern area, and I remind the community that you don't need to necessarily go to the pop-ups that we've put up in place. I remember many of you journalists were at that 3:15 press conference last Friday when we identified very quickly the Crossroads Hotel as an issue, and by 5 o'clock the health staff in southwestern Sydney had come together and set up a pop-up clinic at the Crossroads car park. And they've since expanded that, and they've now got another one at Picton. But I just want to thank them because the staff have been run off their feet. The preparedness of the community to come forward when we called on them has also meant that we've had to really call on our staff, and the health staff have just been incredible. Many working much longer hours than any human being should actually be working. So I want to thank them for doing that. So I want to just remind the community of the various venues where they can go. They don't need to be waiting for any length of time in a pop-up clinic. If they happen to be particularly popular, and they are, well, you can make a decision to pop off somewhere else, pop into one of the other facilities. And I just remind the community that we have clinics available, COVID clinics available at Liverpool Hospital, and that's right near the ED there, the emergency department. We have a pop-up clinic at the Crossroads, obviously, we've talked about that. We have another one now at the Ash Road Sporting Complex at Preston's. Campbelltown Hospital, you can go to Campbelltown Hospital. Wallandilly, there's a pop-up facility there, and that's at Victoria Park, 196 Menangle Road, Picton. Camden, we have a pop-up walk-in at the Camden Hospital. That's at 61 Menangle Road, Menangle. We have another facility at the Narellan Community Health Centre, 20 Queen Street, Narellan. That's also a pop-up there in Camden. We have obviously our facility that's been there for some months at Bankstown, Canterbury Bankstown area, but the Bankstown Hospital. We have another one at Fairfield Hospital and at Wingecarribee Hospital, Wingecarribee area at the hospital there at Barrel District Hospital. And tomorrow we'll have another one, yet another one. Another one will be popping up, a walk-in one at Mossvale Showground. So starting tomorrow morning at 8:30. So I just really want to emphasise to the community that you don't have to wait in long queues, just pick another spot. And there are some of them that are a lot quieter, and that makes good sense. Dr. Chant in a moment will give a list of the various businesses. I say to the community, if you've been in any of these businesses where we've had somebody who's been into the business, and your risk factor may be low, but it's still, we have to work on the basis that no matter how low the risk is, New South Wales, our health team wants to make sure that we do everything possible to track down, to do the detective work on who may have been in contact, reminding the community that this virus can linger on hard surfaces. It can linger in the air as an aerosol if somebody's walked through and you happen to walk through it. So it's a good idea, a very good idea, just to listen to the advice from New South Wales Health, and to, if you have been in any of these locations, then no matter how small the risk is, to go and have a test. And Dr. Chant will highlight that in a moment. I can't tell you how proud I am to be the Health Minister of the New South Wales Health System, working with the staff in health. Doesn't matter what aspect, it's everybody from the cleaners to the security staff to the nurses to the doctors to the epidemiologists, but the ones who are really taking us through this journey to try and track down and do the detective work are our tracing team. In a moment we'll listen to Dr. Chant updating us on some of the public health issues, but then I'd like to invite Jenny Mustoe. Jenny is quite an incredible person, but she reflects the quality and dedication of the people who are doing the job here in New South Wales. And I just think after 5.5, 6 months, the community probably wondered how we got to the point where New South Wales effectively had no transmission, and why we're hoping to move to a position where we can reduce transmission. I want to say to the whole community though, don't get an expectation that it will always be zero, because we think this virus will continue to transmit lowly and through the community, and from time to time we can fully expect, this is a world pandemic, it's a 1 in 100 year event, so you can expect that we will have transmission from time to time, and that's just the way it is. We've got to accept that this is the new world order, but we have the very, very best of staff here who can do the work to try and keep us safe. Jenny is amazing. She has worked on and off, I say, for New South Wales Health for about 20 years. But talking of war zones, she's been there. She's been in the war zones. She really knows what it's like to be facing down a war zone and be dealing with outbreaks of the most horrible infectious diseases. Just in the last few years, she has been in, the last 2 years, let's pick those, she's been in Bangladesh and Yemen, working there to try and address in war-torn areas some of the similar viral challenges, although, as she said to me, this is a 1 in 100 year event, so it has particular different issues they need to deal with. But her training of having been working in those areas, to have a war zone detective leading such a fantastic group of people, I think is just wonderful for the people of New South Wales. Prior to that period, she also had a lot of experience working across in our Pacific region, so Fiji, Solomons, Papua New Guinea, Vanuatu, and I think when you know that you have someone like this who's doing the tracing, doing the detective work, fighting this virus for us, is incredible. Obviously in those other areas, many of you would already know that We had, I think it was last year, we had the measles outbreak in Samoa that had a terrible outcome for many people. But we have cholera, you have dengue fever, there's a whole range of things that she has been involved in, and you might like to just hear her experience and how they came to use the experience that she had from those war zones to effectively our war zone here, although I have to say at the moment that our war zone is far less than what she has had to cope with in places that I've mentioned and others like Laos and so on. So I'll ask Dr. Chant to say a few words, and then we'll ask Jenny, and then we'll take questions on any of the issues that you might have. Thank you, Dr. Chant.
Thank you, Minister. So I'm sorry the numbers become a little bit confusing because we've moved away from our 24-hour reporting period. So just the ones that of most significance is that the 10 cases reported today are associated with the Crossroads Hotel, and of these, 6 attended the venue and 2 are close contacts, and 2 acquired their infection at the gym attended by one of the cases who acquired the infection at the Crossroads. So they are a 31-year-old male who attended the Crossroads Hotel on the 3rd of the 7th, a 42-year-old female who attended the Crossroads Hotel on the 3rd of the 7th, a 27-year-old female who attended the Crossroads Hotel on the 3rd of the 7th, a 14-year-old female who's a close contact of the Crossroads Hotel staff case, a 27-year-old male who attended the Planet Fitness Gym in Casula, a 24-year-old male who attended the Planet Fitness Gym at Casula, a 53-year-old male who attended the Crossroads Hotel on the 3rd of the 7th, a 22-year-old tertiary case from the Crossroads Hotel, so that's a contact of our case, and a 33-year-old female who is a close contact of the Nepean Blue Mountains case previously reported, who attended the Crossroads Hotel on the 3rd of the 7th, and a 17-year-old male who is a tertiary case from the Crossroads Hotel. Since 8 p.m. last night, we have identified 1 additional case reported, and that's linked to the hotel cluster, bringing the total number associated with the cluster to 34. And that's a male in his 20s who is a close contact of one of the confirmed cases. And I think this highlights the rapidity in which COVID can spread and the importance of us identifying these cases very rapidly, ensuring that contacts are in isolation. If cases are isolating and they develop the disease and they've been in isolation for the 48 hours before symptom onset, then in essence we've broken those chains of transmission. So I'd like to now go through some of the advice about who we're asking to isolate, but I just really want people to adhere to this advice. And the fact that I've listed all of these cases highlights the importance of people taking those actions in order to prevent further transmission. So the staff and patrons who attended the Planet Fitness Gym in Casula between the 4th and 10th of July are now considered to be close contacts and are being advised to self-isolate for 14 days and seek testing. Now this is because we have the 1 case, plus now we've got 2 subsequent cases who were infectious whilst at the gym. It's essential that anyone who was there between the 4th and the 10th of July are considered close contacts, and please self-isolate and seek testing. I would also like to thank the gym for its cooperation. It was able to provide us with lists of people that attended the gym, and we have communicated to those individuals, and we will be continuing to pursue multiple ways of contacting those individuals, but it is essential that we get that message out for those attendees of the Planet Fitness Gym in Casula between the 4th and 10th are now considered close contacts. Please self-isolate and get tested. The other venues attended by the cases in the Crossroads Hotel, there are a number under investigation, and I urge the community to go to the website that we're constructing, which will have the full list of venues, but I just want to highlight a number. So the YMCA at Revesby, in relation to a case attended that on the 9th of the 7th between 4 p.m. and 1600 hours and 2000 hours on the 9th of the 7th. and also on the 11th of the 7th from 0800 hours to 1200 hours. Also, a case attended while infectious, the Western Sydney Leagues Club, between the 11th of the 7th, on the 11th of the 7th, between 2000 hours and 2400 hours, so that's midnight. Also on the Western Sydney Leagues Club, someone attended on the 12th of the 7th, 20, between midnight and 2 o'clock the subsequent morning. And the Macarthur Tavern on the 11th of the 7th, 2020, between 21:15 and midnight, and then till 40 minutes after midnight they departed on the next day. And Woolworths at Bowral, the person worked at that facility on the 11th of the 7th, 2020, and on the 12th of the 7th between the hours of midday and 2100 hours. As I said, as you can imagine, we're doing intensive case interviews. We will release the information on any areas that we want to draw to the attention of the public at this time. So can I just remind people that we are asking anyone who attended the Crossroads between the 3rd of July to Friday the 10th of July to self-isolate, get tested, and regardless if you have a negative test, remain in isolation until you've not attended the Crossroads for 14 days. Also, one of the cases worked at the Casula Kmart on the 10th of July from 5 p.m. to midnight, and we've made that information public. Now, whilst we've had a very strong focus on the Crossroads Hotel cluster, it is very important that we don't lose sight of the fact that COVID could have been introduced in any other parts of Sydney, and we may well have had transmission of the virus just continuing. This is a stealthy virus. We need to maintain vigilance in other parts of the state, and it is essential that anyone who has symptoms compatible with COVID comes forward for testing. It's pleasing to see that we had 17,660 tests were notified in the 24-hour reporting period, but I'm actually hopeful that we can really hit some further highest test number cases. I think we've managed to get over 23,000 in the past. This is the time for the next 2 weeks. This is not the time that I want you to come forward. If you've got any COVID symptoms, get tested. If you've been in these areas that we've announced, symptoms or not, come forward for testing. I'm also very concerned about areas where we may have had a number of visitors from Melbourne in particular and the Mitchell Shire. And so particularly the coastal suburbs and our border communities, we need to have high rates of testing so that we can prevent if there's been any seeding, that we can mop it up and block those chains of transmission. And I think the Crossroads highlights that we are not going to gain control of this if we don't have the community on board. And can I just again echo the Minister's appreciation for the magnificent community of southwestern Sydney who have heeded our warnings, come forward for testing, and you can see how those actions of those individuals have truly prevented very more trains of transmission. We're also going to be requesting that people in this general area, we need about 2 weeks to really understand that we've mopped everything up. So the best case scenario will be we've blocked all these chains of transmission, we can have a period of time with high testing rates and be confident that we've stopped it. Okay, that is the ideal. But in this period, we need to be increasingly vigilant. So even if you haven't been at these places in that area, please come forward for testing, because that gives us assurance that we haven't missed any inadvertent transmission. It also means that we're asking residents that live in these areas to be particularly careful about visiting aged care facilities, disability services, any institutions and hospitals. So non-essential visits, just don't go to those facilities, just till we get assurance that we're not missing any chains of transmission, because we know how critical it is if COVID-19 gets introduced into aged care facilities and other vulnerable institutions. I'd now like to hand over to Jenny Mustoe to give a bit of a story about how the Crossroads cluster was identified. But I'd also like to call out the cases. You know, we couldn't have got this detected if there wasn't the person in the Blue Mountains who actually came forward for testing. So very much a call out, and they're the heroes. They're actually the heroes, as well as our other heroes here. But also a very astute clinician, an amazing clinician, a junior clinician at Liverpool, who a patient came in with unexplained fever and got tested, and those two actions by that individual and that registrar enabled us to put the puzzle together with the good work of the detectives. And I'll now hand over to Jenny to actually describe how that event occurred.
Maybe you could just give a little bit of background as to the people who are working here too, and through the public health teams, and then do that.
Sure. Okay. Good morning. So just to describe how the Public Health Network works so you can understand what the scene looks like. And so we have a number of public health units around the state who are responsible for managing their own cases for a number of different diseases. COVID is one of them. And then we have a central team which has been leading the COVID response for the state, and of that I'm the manager of the operations team. And so each of the people in the public health units manage their own cases. They interview their cases in very detailed ways and try and find what their close contacts are, who other people, what other people might have been exposed, and where these people might have been exposed. And then what we do routinely is look back in time by 14 days to try and work out how these people were exposed, how they got infected. And because we have been so good at suppressing transmission in New South Wales, we can do this really thoroughly because we've had so few cases. So of those 14 days, what happened was one person from one public health unit, the Liverpool Public Health Unit, was interviewed very thoroughly. At the same time, the person from the Nepean area was interviewed very thoroughly, and that information came into us here in the Ministry of Health. And he had reported he'd been to the Crossroad hotels, so we went back and asked the other woman in Liverpool if she had been to Crossroads, and they had, and that was it. The link was made. It's not that difficult, it just takes a lot of time. And so from there, we've uncovered an additional 32 cases linked to the Crossroad hotels. And from there, we've actually learned that the most likely link, supported by epidemiology, is that a man from Melbourne came into a workplace in Sydney, and then there was some transmission within that workplace, and then they all went to a party that night of the 3rd of July at the Crossroads Hotel. So this is where it all began.
Okay, thank you very much. So does anybody have any questions? You want to say anything else? You think about it?
No, I don't want
just talk to us
They'll
a
ask
bit
you
more
questions,
about
Jenny.
that
Sure.
workplace, that patient zero, I guess. So it's the patient zero that we think that is the person that's come from Melbourne is not the Blue Mountains man.
No, that's right.
A colleague of the Blue Mountains man.
No, not even that. They just happened to be at the Crossroads Hotel on the 3rd of July. And so we've made these links with extensive interviews over multiple public health units. And the story, as we get more information, tends to change a little bit. So the man from Melbourne didn't think he was particularly unwell, didn't think he was sick with COVID. He travelled on the 30th of June. He's been in New South Wales for a while. And it wasn't until we interviewed him and his colleagues with more detail that we made the link that they were all at the Crossroads on the 3rd of July.
He's in the freight industry, Jen?
He is in the freight industry, as reported in the media, yes.
Yeah, a truckie or?
No, he's not a truckie.
And he'd been at a workplace, and so his colleagues are among the group that have been infected?
That's correct. There are people in his colleagues who also then went to the party on the 3rd of July.
Where is those colleagues have been?
Off the top of my head, I think it's about 6, but I would have to check.
And are we counting those in the Crossroads cluster?
That's correct.
Yes, that's correct.
They're all linked in the Crossroads cluster. They're not hidden cases anywhere else. They're all reported as Crossroads.
And so where is that workplace? What is it?
We haven't actually announced that, and we won't be at this point. We'll consider that.
Okay.
There's more work to be done on that.
There's no risk at that workplace.
What about those people? Where else have those people gone? Have we been told where they?
Yeah, so this is exactly what happens. So we interview all of the cases very thoroughly, and then we do the contact tracing, which I'm sure everybody's heard of by now. There's been a bit of attention on contact tracing, and all of those people are contacted, asked to self-isolate for the relevant 14-day period and get tested if they develop any symptoms. So as far as we know, this outbreak is were known to us, and we've identified all links at this point in time. But we'll get new cases and we'll have to identify further links with them and further contacts and get them all to go into isolation as well.
And with the genomic testing, so you've got those results back now, is that linked, that Melbourne man carried the virus from Victoria, and what cluster is that connected to?
So the whole genome sequencing, which we've been doing in New South Wales since the beginning of COVID, and now it's routine, we managed to link 2 earlier cases from Albury, one with a travel history to Melbourne, and the fellow from Katoomba with the man who has travelled from Melbourne, and they all are identical, and they match the publicly available Victorian sequences that are available on websites that our scientists have worked through.
And can I just clarify, there's not, just so there's no confusion there, there was individual, just to clarify Jenny's statement there, just to clarify that the cases, so we had, remember the Albury cases that we'd indicated, so that's routine, we're genome sequencing it, and clearly we'd also indicated that one of those people as part of that cluster, Albury, had travelled down to a hotspot in Melbourne, and so the genomics just confirms that, because obviously I've mentioned to you we've got to keep an open mind. Even though we might have that as a hypothesis, it's important that we collect additional information, and that's why the genome sequencing on that person indicates that it's a Melbourne strain. We are then also looking at the person who came up directly from Melbourne, who was staying in I think the Sutherland area. That's the other case. So we don't think those ones are linked. It's just that the genome sequencing is being done on those cases. All we have at the moment is one case, who is the gentleman at the Blue Mountains, whose sequence does match the publicly available reported sequences from Melbourne. But our genome sequencing staff are working as we speak now, and we believe we'll probably get some additional data today. And what we would be hoping, I suppose, to find is that all of the virus from all of these cases is actually matching and consistent with acquisition in terms of our hypothesis that it was introduced from Melbourne. It's really important we don't close down lines of inquiry. We're not convinced, whilst we had very low levels of transmission in New South Wales, we were very cautious about ever saying we'd eradicated or got rid of it. We have to remain vigilant that could be low levels of transmission of other viruses, other COVID strains in the community, and that's why until we've got all of the information on the genomic sequencing, we can't be definitive about the source, but we are working quickly to do that.
To be clear, sorry, just to check one thing with you, Dr. Chant. The Melbourne link, this is the concern that I think what we're all trying to get to the bottom of is the issue with their hotel quarantine. Has that now infected Sydney?
Well, all we can say at this stage is that we clearly have cases that have acquired their disease in Melbourne. I think I've reported over the last week or so, we had the young child that had done the right thing, got tested before, was advised it was negative, then advised it was positive, and we did some contact tracing around the Merimbula area and the Tathra Hotel. We had the Albury cases, and we're obviously trying to find out their source. They did give a travel history. So, of course, given the degree of community transmission in Melbourne, in particular those hotspots of Greater Metropolitan Melbourne and the Mitchell Shire, I think we've been messaging for many weeks that returning travellers from Melbourne, I think we've also given messages of now's not the time to travel to Melbourne in those areas, whilst they have such high levels of community transmission. And people have actually got to self-isolate if you've arrived back in New South Wales after the 8th of July, unless you've got particular critical services exemptions for that. So we are expecting the community to do their bit in preventing any further seeding in New South Wales, and what we are keen on is tracking down any community transmission that may be occurring so we can prevent these chains of transmission in the community.
Dr. Chan, or maybe Jenny, you mentioned there were 2 tertiary cases. Is that the first time we've had tertiary transmission, and what's the worry with that?
I think the tertiary transmission means that highlights the importance of getting to people really quickly. So what we've seen is we've actually seen some quite short periods. The incubation period for the disease, I think we've all been through this is like 1 to 14 days. And I think what's been interesting is we've seen some acquisition which has been very short. So people have developed the symptoms more towards the 1 day period than the 14. And so it's essential that it gives you very little time for the contact tracers, because you've got to get your case diagnosed and then you've got to lock down those contacts. And so I think it just highlights the speed. So my message to you in the community would be, if you've got a sore throat today, don't wait for 2 days to get it diagnosed. Work with us, go get tested day one, because every day you can give us allows us to stop that spread. I don't know, Jen, if you want to reflect on that sort of sense of urgency.
No, that's exactly right. So we have had multiple trains of transmission before, but this does seem to be moving very quickly. So just to emphasise, slightest bit ill, please get tested. And thanks again to everyone who does get tested and becomes cases and shares all their information with us. It's the only way we can actually do this.
Can I say something to you? Can I just say, the question that you asked, Ursula, I want to stress something here. Our focus here in New South Wales is not to lay blame. Our focus is to make sure that our community is kept safe. It's a public health issue. We need to understand where the transmission has come from in order to understand where it might go and to break the chain of transmission. I don't think it's appropriate to lay blame anywhere on any particular issue coming out of Victoria. As the Health Minister here, I'm very conscious of the fact that there but for the grace of God goes everybody here in Australia. This virus could win a gold medal at the Olympics at the speed at which it moves, and that makes it particularly dangerous. So let's not throw stones at other people. Let's work with our Victorian colleagues and let's support Victoria, and that's what New South Wales Health is doing. That's what the New South Wales Government is doing, and I, as Health Minister, will certainly not engage or entertain any idea of actually laying blame anywhere else.
Minister, you mentioned
Sorry, Ursula first, because I was just answering, then I'll do yours. Yep, sir.
Why not lock New South Wales down?
The advice from New South Wales Health is to do exactly what we do. We've always worked on the basis of the advice from New South Wales Health, and I think that's proved to be a very successful formula. And you've just heard that the type of professional qualifications, Jenny and her team from Yemen, Bangladesh, war there to war here with our COVID virus. I'll continue to take her advice, and that will be it. Sorry.
Minister, you mentioned the dangers of aerosols, people going in shops and mingling. Is now the time to tell people you should wear masks?
The advice from our public health unit is that if you're in an area where you can't maintain social distancing, then it doesn't hurt to have a mask. So it's probably there are a variety of views on this, as everything in science and health has. It's joys of being scientists. But I would say that if you can't maintain social distancing and you're in a tight-knit community area, wear a mask.
What about, can I perhaps...
Hang on, I might be being qualified or...
No, that's
this is fine. Go, Dr. Chair.
No, that's correct. But I think
Go.
it's a really important point, because let's just go through, and I think sometimes some of the debates can be distractions for the community. The 4 key messages for the community. Don't go out and about if you've got any COVID symptoms. Look, before COVID, we would have all gone out and about, I think, with a bit of a sniffly nose or a bit of a scratchy throat and waited for the next day just to see if we got better or worse. Now's not the time. Now's the time to don't go out and about, don't go on public transport, don't go to work. Your action should be stay at home, keep yourself isolated and get a test. So first, that's the first step. The second step is hand hygiene and social distancing. And the fourth is when you can't do social distancing, wear a mask. It's the fourth line of defence, but a focus on that in the isolation from some of the other issues is not good. So we need the community to adopt all the suite of practices if we're going to get through this. And I can't stress enough, I really need the community over these next couple of weeks to just go and get a test. And please, the testing it's very short-lived, even though you may have shared stories about it being a little tickly or a bit more than tickly. Minister, it is.
I've had it, so.
It is imperative that you play your part, because some of these individuals came forward and their symptoms were incredibly mild. And I think that is one of the characteristics of this virus that make it incredibly difficult and challenging.
Dr. Chan, while you're giving us instructions on this sort of helpful community notices here, for businesses that have those cases, visit them and they close down, some of them close down instantly, some of them wait, is there any protocols you can offer in terms of what people should do, what businesses should do, locations should do when they are visited by a COVID positive patient? Should they shut down, deep cleaning? Who pays for it? What do they need to, what process should they go through?
There's actually quite a lot of detailed information about the cleaning processes for each of the businesses, and many of the big business chains have fairly robust COVID response plans in place. And also Safe Work has a lot of information around those businesses. Now, generally, there will be some interaction with public health. And look, I've got to apologise to any businesses where there's been any lapses in communication. Things were working very quickly, and our priority has to be getting those public health messages. So I'm going to ask for forgiveness rather than permission rather than forgiveness, or whatever, however that saying goes. But I do want to acknowledge the cooperation of business and how essential that is. But we do have cleaning advice and other advice, and we will often that will be a bit informed about the nature of the activities that the case did. In terms of assessing case by case. You've seen in schools, we generally have a day of deep cleaning, and the gym obviously was cleaned, and a number of the other facilities have often cleaned. But it depends on what the person did in the facility, so it's on a case by case basis.
What information has New South Wales Health provided to the federal government about the number of cases that the COVID app has helped to detect? The federal health minister was saying that he's collecting around 200 cases. What cases have been detected by the COVID app here in New South Wales that you've...
So we ask routinely about whether our cases have got the COVID app, and we're actually conducting an evaluation of the COVID app to learn how it can be best integrated and best used. And we do provide that data to the Commonwealth. I mean, we are all in it together, and the COVID app is one of the tools, but I think what Jenny has also indicated is it's the patience of those community members who give us incredibly detailed conversations. And it's not just often one. It may be a series of initial interview which might go for an hour, and it might be a series of further follow-up. And I think the community cooperation in giving us that accurate information is so essential for our work. So I'd just like to acknowledge that regardless of the COVID app, we'll incorporate that in and use it, but we want to also acknowledge the fantastic efforts. I remember trying to find out actually one of these original cases, and the public health unit had given the diagnosis, locked down the family and thing, and I'm going, when will we find out some information? And they said, the gentleman's just having a cup of tea, and then the public health unit will give them a ring back in 10 minutes and get it down. Because you can imagine, out of the blue, someone's telling you you've got COVID, you've got to lock your family. It's just that pause, reflect, and then the public health unit goes through that hour-long interview where you get grilled on all your movements. So I just want to extend my gratitude to the community in being so helpful in giving us that information.
Dr. Minister, can I just ask you, despite the growing numbers today, your tone seems really positive. Is that because we now think we've got patient zero? Is that how big a deal this is?
Look, this is a stealthy virus. I do not want complacency, and I hope that my tone today has indicated the gravity of the situation. We are in a period that I need that 2 weeks of assurance that we've actually blocked those chains. I need everyone to adhere to the health advice. I need to not only maintain that focus on that area, but I need to make sure there's a focus on the state, because there's no point in having all our attention here and missing similar events elsewhere. So for me, this is an incredibly critical period of time as we work with our colleagues in Victoria. And I think it's essential that we, if anything, we just reinvigorate and don't lose that we became a little bit complacent. And if I can ask anything, can the community just give us another couple of weeks about really being attentive, that social distancing, hand hygiene. Also, some of the areas that we know have caused issues in disease transmission in international and other settings. we often think about our social network of friends as sort of safe, and the behaviours we adopt with them are different from what we might do in the community. So we might see, travelling on public transport or walking down the street as the most risky thing we do. COVID's not like that. The riskiest thing we do is party with our group of friends, because that's when we're not socially distancing. And so we do need to get the community to recognise that, and don't go to any events if you're unwell. And at this period of time, can I just ask the community to just reflect on those messages and maybe limit your social gatherings, particularly if you're in that area of community transmission. So let's just work together. But I'm far from relaxed. This is a critical period for us. And I need the cooperation of the community for the 2 weeks. But I'm blown away, and I suppose my degree of optimism is, having 3,279 people in southwestern Sydney going to the public labs yesterday, and that doesn't reflect how many people went to their GPs for testing.
Do we know
Just is inspirational.
Sorry, do we know how many people were at that party? The one that started the Casula cluster?
At the time, people could only go to the hotel in groups of 20, but I think the point we're trying to make is that there may well have been not just one person who was infectious at that time. There might have been between 1 and 3 people. But again, we need the media to not sort of have the blame game. I mean, yes, we've got to get the messages and we've got to get compliance, but at the moment, the last thing we want is people to come forward and get diagnosed and testing. And so when we act in the way we're acting, we do need to understand the public health objectives is basically to block transmission, and that will be our fundamental. We will share all of the information relevant to informing public health risks, but we've got to balance that, because we know if we get that balance wrong, we will end up with a worse outcome. So thank you.
Jen, you spell your name.
Jennie, Musto, MUSTO.
Thanks so much.
Thanks very much. If you can actually also make sure the community remember that complacency is the killer, and no matter what goes on now, complacency, if it is the overriding force here in New South Wales, we are still in deep trouble. Complacency, no. Hand hygiene, stay home if you're sick, and just take all those public health measures that we've talked about for months. It was working, and hopefully it will work to the same advantage that we got before once we managed to get this all under management. But I worry. I am really worried. We are still effectively in a war zone. As has been said, this is one stealthy virus that's a gold medal winner when it moves quickly. It'll win any race against us. We need to get on top of it. So just please don't be complacent. Thank you very much to everyone, and thanks again for your time today. Appreciate it again. Thank you.